Hello students, today I will be teaching you how to do a blood glucose level using a glucometer kit. I will explain to you what the kit contains. There is a glucometer, then there is a lancet device. I will show you just in a minute how to load this with a new lancet, and we have got testing strip, and this all comes in this bag, this whole pack, and it has a carrying case also. We've got some extra test strips and some extra lancets. We'll show you how this scale is done. Now, how it is different to a hospital procedure. In hospital, as you must have seen, that the lancet is not of like this type. It is an encapsulated safety device so that nobody gets pricked, and then the whole thing is disposed. In this, you have to load every time with the new lancet. So yeah, I forgot to tell you that this thing comes with a diabetic solution where you can record your readings, how they go up and down, and you can show it to the doctor. Or the glucometer also has nowadays a mechanism where it can be downloaded or something, stored in the memory. It has got a user guide and a quick reference guide, but not so important in this presentation. So why this is done, why it is so important? It is important because usually in a diabetic patient, the more hypoglycemia is a bigger issue, hypoglycemia than hyperglycemia. But the idea is by medication, by diet, exercise, to keep within the normal limit, which is usually about 4 to 8 usually, although fasting is about 6. So we, first of all, I will show you, I've already washed my hands with soap and water. Now, normally alcohol is, some say alcohol is okay, alcohol while pricking, before the pricking, alcohol swabs, but it may interfere with the result, and therefore just washing with warm water, soap and water, and then massaging just before you're not got to that state, but just before you are pricking, just trying to milk and bring the a warm massage, or maybe again a warm wash would be okay. So we covered the difference in the hospital environment, description of the contents. Yes, in the description I must tell you that the test strips has expiry date, which is here. It says, yeah, here in the other one it is okay. It says March 21, so still it is okay. But it is said that once you have opened it and used it, then you should consume within 4 months. Otherwise, they may not give the good results. So we go on first to load the lancet device. So we open like this, right? Are you understanding up to now, students? Good. So you open like that and take a lancet, and not this side but this side, you go click, and then what you have to do is you have to revolve like this 2-3 times, and the cover comes off when the lancet is there. And now we load it. Now in this one there are many markings, 1, 2, 3, 4, 5, but 3 is usually advisable for any normal person. If somebody is having thin skin, or as in females, it is said that even 1 and 2 could be okay. And somebody who is working very hard with his hands, has got calluses or tough hands, maybe even 4 or 5 might be there. So, but normally just keep it at 3. And you don't push the panjara, because then by accident if you press this, then it will go and prick somebody. So for the time being, you be like that. Okay, so yes, I've got my hands washed with warm water and a massage like this, and then milking like this towards the end, whichever hand you want to really concentrate upon. And then you take the test strip and this is the end which goes inside, the end with a marking, and the other one you can see that takes the blood. So we put like that and it automatically ons, and you place it like that. It says apply blood. Now lancet should never be reused, so after every testing you should throw the lancet. It is recommended. And then you milk like this. Zip it to hand. Mostly these 2 fingers are better, recommended. Never prick on the center, the bed, the pulp. Always do on the lateral side, lateral aspect. And it is advisable that to keep, against a hard surface, so that because some patient may have natural tendency in anticipation, they might, like a reflex or something. So it's better. But in my case, I'm just doing like that. Now, because I've not used alcohol, you can take first drop, but still I will see about the second drop. Okay, go according to the best procedure, whether you apply alcohol or not. You just take like that. Here's the blood, and in a few seconds ask the patient to with a cotton wool or something, and the result has come little high, 0.1, and that is how. And then we discard, and also we discard the test strip into the normal bin, and this one lancet into a sharps container. So this is, let me see if I missed something. So yeah, never to use a lancet, all right, and obviously even the test strip is only used once. Yes, basically this completes the presentation. Have you all understood, and do you want to ask any questions? Because I use slow English so that learners with English as the second language, they also don't have much problem. I hope you have understood. If not, anybody can ask any questions, or if you want I can even repeat. But best is that you come and you come yourself and test out for yourself, because that is the learning by doing it yourself. That is the best, obviously, learning. So yeah, I think so. Here's me, Anurag, logging off. Sorry, I forgot to tell you, in the hospital environment, obviously you will also use the gloves. And sorry about this writing. I thought it would come in the camera, but next time I'll write more. Thank you. Bye.